I'm Dr. Bill Lyle, and for just a minute, I'd like you to use your imagination. I'd like you to imagine that you are home, you are alone, and all of a sudden you hear tires screeching, you hear a crashing sound, and you rush out your front door and you see what is obviously your daughter's car has just struck a telephone pole. You rush to the car, you look inside, and you can obviously tell by what you see that your daughter tragically is dead. But then you look in the back seat and you can see your grandbaby is still alive and in the car seat and moving around on the inside. Yet you can smell smoke. You know that there's a fire going on. Would you do everything within your power to save the life of your grandbaby? Would you summon superhuman strength and rip the door right off of that car and pull your baby to safety? Sure you would, and I would too. Well, there's something similar that's going on in Georgia. There's a young lady named Adriana Smith. Adriana was 30 years old. She was a nurse at a local Georgia hospital, and she was pregnant. She was about 9 weeks pregnant, already had a 5-year-old son at home, and tragically she had a headache, and for whatever reason it wasn't evaluated completely, and then she was unresponsive. Her boyfriend took her to the hospital and they evaluated her, and sadly she was brain dead. She was brain dead, and there was nothing to do, but the baby on the inside was still alive. Well, the doctors at the hospital realized that this baby is alive. Mother is brain dead, but mother is the life support system for this baby on the inside. So they intubated the mom, and they were breathing for her. And you would think that this would be an amazing story. That baby was 9 weeks along at that time, a little baby boy. Well, now, with the mom being on the ventilator and being given IV fluids and nutrition IV, and the baby has been growing, they look and this baby is now 21 weeks pregnant. And if you follow the news, the majority of the articles in the newspaper and in the different articles online are how the family is being forced to keep this mom alive, to keep the baby alive, and they're blaming Georgia's heartbeat law. They even interviewed the grandmother of this baby boy who is caring for this 5-year-old boy. And I would expect this grandmother to be saying, "This is absolutely amazing. Yes, my daughter tragically is dead. She had blood clots and she is now brain dead. But thank God modern technology and medicine and doctors and nurses are keeping my daughter breathing and providing nutrition and oxygen for my grandbaby on the inside of the womb." It's just amazing. The baby's already 21 weeks along, and we don't know when we're going to have the baby, but my grandbaby is still alive. But that's not the story. The grandmother is actually upset because she wasn't given the choice. She's already raising a 5-year-old, and she wasn't given the choice of whether she wanted to continue the ventilation machine for her daughter, which is the only thing that is keeping her grandbaby alive. There aren't many cases like this, but the tragedy is that the way the media is covering this, that they are upset because the parents, the grandparents of the baby and the parents of this mom didn't have an input on whether to unplug their daughter or not. They should be talking about the miracle of modern technology and science that tragically the mom is brain dead. But they are using her body to continue the life of the baby on the inside of the womb. And the baby will start to be able to survive at 24 or 25 weeks. And I would imagine they're going to try to get as much time on the baby. Now, do we know everything about the status of the baby? No, there's no way that we can tell if the baby is 100% normal or if there are some serious problems. But let's give that baby a fighting chance. We treat the preborn as patients in the womb, and we are created in the image of God at that moment of conception. All life is precious. We are now doing blood transfusions, open heart surgery, spina bifida corrective surgery, even brain surgery for babies in the womb. A patient is a person, no matter how small. We mourn the loss of Adriana Smith. It is a tragedy. And it is disturbing that she had blood clots and this occurred. And I don't know any other details about the mom. But I do know that the baby is still alive. And I find it personally absolutely amazing that these doctors are able to keep this baby alive and growing for this long with modern technology. So we need to celebrate life, we need to protect life, but we also need to understand that life is precious. And we need to love our loved ones and tell them that we love them, because we never know when tragedy will occur. This young lady, tragically, was 30 years old, had a 5-year-old and another baby on the way, and she has been thrust into national media attention. And I couldn't find many articles, if any articles, that were celebrating the modern technology and these bold doctors that are keeping this mom and giving this mom the ability to keep this baby alive. So we'll keep it in the news, we'll keep you updated. But if you have any questions, you can contact me, Dr. Bill Lyle at prolifedoc.org. I'm board certified in obstetrics and gynecology. I'm licensed in multiple states. And yes, when I have a pregnant patient, I have 2 patients. If she has twins, I have 3 patients. We do everything we can to save the lives of all of our patients. Tragically, we are not going to be able to save the life of this young mom. But with amazing technology and dedicated doctors and nurses, we have a great chance of saving the life of this baby. Stay tuned. God bless you. And if we can be of any assistance, give us a call. A patient is a person, no matter how small. prolifedoc.org.